32-year-old Oneida Salam was supposed to be discharged over a month ago at the Upper West Regional Hospital where she was admitted to the medical ward. She was diagnosed to have kidney disease, prompting medical doctors to refer her to the dialysis center for treatment and later to be discharged. Due to her unpaid bills, which are pegged around 5,800 Ghana cedis at the time, Obeida is unable to leave the hospital and has piled up additional 4,200 Ghana cedis in the last handful of weeks for dialysis. Joining us, Upper West Regional correspondent Rafiq Salam, who visited her at the dialysis center, reports that her bills have now risen to a little over 10,000, and she's calling on government and benevolent organizations to come to her aid to offset her bills to enable her go home.
In charge of the dialysis center of the Upper West Regional Hospital, Kurusa Daniel removed the veil on the myths surrounding dialysis.
Especially within our community here, people think like when you are having kidney problem and you are supposed to do dialysis, it's a death warrant, but it is not so. So we are doing our best to actually demystify that perception that the public hold.
The dialysis center of the Upper West Regional Hospital was established in November 2022 and has since attended to by dozens of patients. One of them is 32-year-old Obeida Salam. She cannot exactly state when she had a kidney disease that requires dialysis, except to list the symptoms that force her to come to the hospital for a medical examination.
I had swollen legs, bloated stomach, puffy face, and high blood pressure. I have never been to the hospital without the doctors telling me I have high BP.
The mother of 3 every week comes to the dialysis center twice for treatment. She is required to pay at least 450 Ghana cedis for each session, an amount that she struggles to pay considering the petty business that she is in, selling soft drinks and sachet water, carrying them overhead. Her husband is a master craftsman, but barely had work that can take care of the family, let alone paying for dialysis.
It is difficult for us to pay for the dialysis. Sometimes we owe them, and anytime we get the money, we pay back. Our being here is being taken care of by our blood relations. We are very poor. My husband cannot afford the 450 Ghana cedis. Without the support of my family, I would have been dead by now.
Obeida was supposed to be discharged by the hospital a month ago so that she could come into the center for the dialysis. She is however unable because she cannot offset her medical bills. Her medical bills at the hospital is a little over 10,000 Ghana cedis, including the dialysis, which she has defaulted payment of 4,200 Ghana cedis.
Because of the cost involved, so especially this woman, she's supposed to have gone home, I think last 2 months, and be coming for dialysis. But because of cost, they can't even offset the hospital bill at the ward level. So they are forced to be here and be coming for the dialysis till they pay the bill, then they go home. So for her like this, it's the cost that is keeping her. If not, she would have been home and be coming for dialysis.
Unemployed middle age, Mariam Yahya is a mother-in-law of Obeida. She says they are at their wit ends and seem to exhaust all channels to enable them for the medical bills.
We have nowhere to go for money again, and yet our bills are piling up. It is because we are unable to offset our bills. That is why we are still here.